Hi, my name is Dr. Christina Cuck, and I am going to be giving a presentation on seeds and the science behind it and the nutritional value behind the seeds that are in certain products. I'd like to start by giving an overview, just some quick information about myself. I have a bachelor's, master's, and doctorate degree where I emphasized studying science as well as neurological pathways and the healthcare business side of science, as well as how to deliver that science in research projects, investigator-sponsored trials, and in publications to the FDA or to various societies and publication committees in the United States and worldwide. I've worked as a research director in a grant with the National Institute of Health for Boston University, where we also worked with Yale and Harvard and Wake Forest, and we studied seriously persistently mentally ill and how to treat these patients effectively in the United States in a continuum of care approach from wellness, nutrition, all the way through those individuals being back at work in the community. Additionally, I've worked in medical science, clinical science, and research science departments at various pharmaceutical and biotech companies. That includes Biogen IDEC, Alexion, BMS, Pfizer, UCB, Janssen, J&J, etc. I worked in these companies as I studied and taught immunology, hematology, and oncology, as well as I also worked in the HIV and infectious disease space and dermatology spaces. I did this by studying the different products, working in the lab with different products, and presenting different ways we could use those products through investigator-sponsored trials by working with IRBs and the FDA. I also have done speaking engagements at universities. In addition to me teaching while I was a graduate assistant, I have taught different classes for pharmaceutical and biotech, and also for different countries such as India, the government of China, and in the Middle East, etc. I also did CME classes for the oncology and the neurosurgery and orthopedic surgery departments at Johns Hopkins University. Recently, over the last 8 to 9 years, I left the biotech pharma environment of the publicly traded world, and I went into starting various companies in the healthcare space because I felt like there needed to be more of an emphasis on the best path of care that focused on wellness and nutrition, and not just on what happens when the patients get sick or individuals get sick. So with that, I have started and founded DC2 Healthcare, NOC2 Healthcare, C3, NRIOM, Datum, MLPP, MTS, President Spine, etc. In starting these companies, they've gone into some acquisitions and mergers. The others are still around, and then some of them have been started in addition around the tribal health space. Those companies did a variety of things, from helping patients to helping individuals to working with doctors to improve the best format of care, and then also delivering to hospitals the best format of care, as well as certain products and devices. So while I was running and managing and directing these companies, we did sell some, as I said in the past, in acquisitions and mergers, and I have been able to sit on various boards of directors in the healthcare world, including recently, over the last couple of years, various boards that are dedicated to Indian health and tribal health, as well as foundations and 508s. They're dedicated to the spiritual health of individuals as well. And that's been a very rewarding experience for me, to be able to work with different populations and different groups which have been minorities and have not received as much attention. So anyway, enough about me. Let's go and talk about seed science. I want to start with black cumin seed. This is a very powerful seed, and the oils in this seed are very powerful. There's about 990 articles on the black cumin seed that can be found at PubMed and on the NIH's side, which is a huge credit to this seed, because you don't have major pharmaceutical companies backing it. So you had a lot of scientists that studied this because they knew about and they know about the potency of this product and what it can do. And you don't have the huge money behind it, but you had people studying it regardless of scientists, because they understood how important this seed is. If you go back and you look over the 990 articles about the black cumin seed, and that's just scratching the surface, there's a lot more, but the ones that I've been exposed to and read, I've noticed that there's a huge emphasis on the fact that it improves blood sugar through the glucose monitoring, and it stabilizes the glucose basically through all the articles that I've read. And you have a lot of evidence-based medicine which is showing this almost as a control in diabetic patients in small numbers. Of course, I'm not going as far to say that it does this, but I am saying that in the studies that have been presented on NIH's site, it shows serum C-peptide changes in body weight that are measured by using this product. And what that means is this product is going in and it's doing a basically insulin-resistant beta cell function analysis, and it's stabilizing this in the system somehow and regulating it through the healing properties of the black cumin seed. It's also showing in other articles that it has antibacterial and even MRSA effects in the lab, which is huge because, as we all know, MRSA is one of the main bacteria that kill individuals in this world. And so in the lab, we're actually able to see that black cumin seed can protect individuals against this. So it's definitely almost like a shield against viruses, bacteria, etc. when we look at this product in the lab. Another thing that's very interesting about this product is it's showing that it's actually protecting the immune system, and that it's protecting the nerves in the immune system. It shows anti-epileptic effects for kids with seizures in one article that I was particularly interested in, because this is showing that it's actually going in and probably protecting the nerves in the patient so that an epileptic event does not happen. This is huge because that would encompass different other issues people have, such as MS and various other immunological problems that people have. So it's huge that this product has these properties. Another thing that's very interesting, because I've worked a lot in oncology and hematology, is that it's showing that it's causing cell death. So various articles are showing cell apoptosis of cancer cells, and that means the cells are dying. So when black cumin seed was introduced in some of the studies that had leukemia, and also looked at the colon, looked at blastomas in the mouth and in the body, etc., it showed that it was killing these cancer cells, which is huge. Again, there needs to be studies with patients, so this can go even further, and we can make even a more conclusive statement about it, but it did show that it was causing some cell death. Now, also another thing that it was very interesting is, I'm sure everyone has heard all the debate about cannabis and THC and marijuana. What we do know about cannabis is that it has some healing properties, although we also know that it causes and it can offset certain mental health issues as well as cognitive impairment. If black cumin seed is used, it's showing that it will offset that cognitive impairment with people that have used cannabis or that are using a lot of cannabis. So in some countries, cannabis is used to treat cancer and various diseases because of its healing properties. But the problem is, again, it can cause the cognitive issues, and this black cumin seed will help in that area, which leads me to think that it could cause additional help in patients that have had brain damage or that have had concussions, etc., and that because of the things that I've seen where it looks at neurotransmission with this product as well as cognitive functioning, it's actually showing that it's improving this in certain people with impairments. It's an excellent source, switching subjects, of a pharmaceutical grade acetylcholinesterase inhibitor, and what that means is it can be used for a wide variety of conditions, and this goes back to what I just talked about with cognitive impairment. You have Alzheimer's disease, dementia, autism, MGN disease, and PTS, schizophrenia, bipolar, Parkinson's disease. It shows a lot of articles which show that this is actually going in and treating this wide range of conditions in certain patients and in the lab when this is used. So when you look at the brain and the scan of the brain, people that have all of these various cognitive impairments, they will show different hot areas when you're doing an MRI. When using this product, it's showing not so much of a hot area, more of a yellow area where there's been damage, but that it isn't actually impairing the process with the patient. So this is huge. There definitely needs to be more studies in this area, and the dosing on this, of course, has not been determined, but it is shown to have healing properties in these areas and to actually protect the brain so that additional impairment does not occur. I'm going to go on to black raspberry seed, but before I do, I just want to say I was amazed and have continued to be amazed at all the different things with black cumin seed. I've only had the opportunity to work with black cumin seed a couple of times in the lab myself, and I have been more than impressed. And obviously, knowing what I know, I personally think it is a huge product that should be used in various disease states as well as in keeping people well overall. It has huge amounts of properties and products and ingredients, minerals in the black cumin seed that are causing this to happen, in my opinion, and a very effective product when used to keep people better, well, and also if someone is sick, to make sure it's going in to protect those different areas of the body that need protection. So again, we're going to talk about black cumin seed. So it has definite antiviral properties, anti-inflammatory properties, and antioxidant properties. And what that means is when you are using certain percent of black raspberry seeds and they're introduced into the body in some kind of format, and they're able to be delivered effectively, it's able to ward off viruses, it's able to stop inflammation or to make inflammation not as bad, and it's able to actually have antioxidant, which means it's actually able to have some healing properties and protective properties around the whole immune system. And I want to go back and talk really quick about the anti-inflammatory properties. Anti-inflammatory properties in products that stop that are very, very important. Anytime you have an immunological problem in immunology, there's an issue with what's called a cascade effect. And that means basically your body will trigger something that will cause inflammation. And if you look at the body and the process that occurs when that happens, it is definitely a cascade. It keeps going, going, going. So let's say that you have Crohn's disease, or you have diverticulitis, or you have one of the diseases I worked on was paroxysmal nocturnal hemoglobinuria, which is a type of cancer that can just keep going and going and going. Another thing I've worked on is psoriasis, sarcoidosis, gangrenosum, a variety of skin diseases where you see that cascade, and it's just continuous inflammation, continuous redness. If it happens outside the body, it can cause detrimental effects. Scleroderma and sarcoidosis can cause death. Pyoderma gangrenosum can cause death. Those present as skin diseases, but they also are internal, because skin, as we talked about earlier in the presentation at the national meeting, is your largest organ. So if something is showing on the skin, you're going to bet that something's going on the inside. Also inside, if you have MS, so multiple sclerosis, or if you have, like I talked about earlier, Crohn's or cancer, you do have this continuous cascade. So bringing in a seed or an oil that helps with that cascade and has anti-inflammatory properties is very, very important. When people hear anti-inflammatory, they immediately think my knee's swollen, or I have my back swollen, something like that, that is causing inflammation. But actually, when I'm talking anti-inflammatory properties, I'm talking about it on a much huger scale. Chardonnay grapeseed is the next one I would like to discuss. Another one that is very complementary with black cumin seed as well as with the raspberry seed is the Chardonnay grapeseed. And there's a difference between a regular grapeseed and a Chardonnay grapeseed, because the studies are showing that there is definitely more of a reduction of the oxidative stress when you have a Chardonnay grapeseed, especially when it goes up to the higher amounts, and then it's used to balance cholesterol. It does a variety of other things as well, but I think those two in combination with the black cumin seed and the raspberry seed are the most important, because The other two are not necessarily balancing cholesterol, and cholesterol is very important in patients because that is correlated with your heart and your blood pressure and with your overall vascular functioning. So it's very, very important when this is used and when this is able to be regulated. And also, the oxidative stress of the body is what can set off what I talked about earlier, which is your inflammatory cascades in the immune system and can cause diseases. So if you can bring in something that actually reduces stress in the overall system, it's extremely imperative to individuals and to their wellness and their health. And it can actually, from different articles and from the science behind it, ward off things from happening. We all have a genetic makeup and an epigenetic makeup, which can cause us to have variety of diseases and a variety of problems in our immune system. But if we can introduce ingredients into our bodies, it can cause that epigenetic to never be triggered, or it can cause it to be locked back up. So I always tell people, look, it's like unlocking a key to a door, and you go in and you see something you don't want to see, right? That's what happens when a disease or a major virus occurs in an individual. You really want to just back out of that door and not see what you just saw and lock it back up. Some of these products have the ability to not let you in that door to see the horrible things inside that door to begin with, and some of them have the properties that even if you've gone in and that disease has been triggered, you can go back out and it can actually lock it back up. Still in your body, but because you're introducing very positive products, you're not dealing with the effects of that in your body. And again, there's not a particular product we can point to about this, but there is research which showing this over a variety of years. Indian Health has focused on this a lot. And will continue to focus on it because they deal with a lot of herbs. And a lot of other countries have focused on this. The United States has spent time on this, obviously, or we wouldn't have so many articles in the NIH and PubMed site. But there's additional information that's still being explored and will continue to be explored as far as anti-diabetic, anti-cancer, immunomodulators, analgesics, antibacterial, anti-inflammatory, etc., as it pertains to these products. So you would think if you take these products, your body is really doing great, right? And the truth is, if you have these products in the right doses and the right delivery system, yes, these products are very positive to your body and to helping you with certain things and your families with certain items, which can cause extreme distress. There's nothing more important to us than our health. So to be able to take products that make us, and seeds and oils that make our bodies healthy is important to all of us. But I still want to touch upon a few more products that I think are very important. We're going to talk about milk thistle seed. Sometimes you hear milk thistle seed and you think allergies, right? Yeah, it can cause some allergic reactions in certain individuals, but it's really very rare from the publications and research that I've read. The biggest thing about milk thistle seed is the kidney and liver support and protection, which again, those are vital organs. Those are very important. You cannot live, you cannot function without your kidneys and liver. You also can die, obviously, from various things that happen to the kidney and liver. So there's a lot of articles that show the benefit of taking this product, of supporting and protecting kidney and liver. I was even able to see some articles which discussed people that had liver damage and kidney damage from alcoholism or from opioid use, etc., and from drug use, that this was able to basically support that system to get healthier. And I don't want to say this incorrectly, but it was able in people that drank larger amounts of alcohol to protect the kidney and liver in a very positive way. So that was the biggest thing that I saw with milk thistle. It also has some anti-inflammatory and anti-cancerogenic effects, anti-diarrheal effects, digestive issues that it can help with, etc. It also was able to show that it can help with spasms, and it has a lot of antioxidant properties in this product like the rest of them. But really, of the 950 published articles that I read, the biggest thing that stood out that was different with this product is that it has huge properties of protection and support for the kidney and the liver. Going on to one of my favorite seeds, we're going to talk about cranberry seeds. So I love cranberry seeds because not only are they a beautiful seed, but they have very, very high levels of vitamin C. If you've had kidney issues or kidney stones, you guys have probably been told by your doctors to drink cranberry juice. That's because it promotes urinary tract health. So if you get urinary tract infections or kidney problems, the cranberry seed definitely promotes health and can help that system actually get things through if they're blocked, and can also help that system with a bacterial, viral, or parasitic problem in the urinary tract because of the way it's delivered into the system. It's very good at permeating the cells and going into the actual ducts of the urinary tract. Another thing that's amazing about it is the salicylic acid improves your heart health, which is very, very important. It's an active ingredient in aspirin. So the fact that cranberry seed is able to do this, I don't know if you guys are aware of this, but aspirin was actually a product that was used and that was studied at Vanderbilt and a few other universities, and by chance they just happened to fall upon the fact that if you take one aspirin a day, it helps prevent heart attacks. The problem was it can cause some GI impairments. That's the opposite with the cranberry seed. The cranberry seed is not causing a GI bleed. It's actually going in and improving the overall health of the heart as well as the GI tract. So it's a healthy alternative to a pharmaceutical product. Not saying that you shouldn't take aspirin at all, because that's something that's very effective as well, but this is a product that could support the other products that your doctors write. It supports oral health and healthy immune system functions, to the fact that one of the articles that I read talked about the head, neck, and throat cancer and how cranberry seed is able to actually go in and fight that and support healthy bacteria in the mouth after they've had radiation and chemotherapy. Going back again, I already talked about this. It supports stomach health as well as GI anti-inflammatory problems. So a lot of people came up to me after the last talk that I did and discussed with me different GI problems that they had. I don't have the answer as to what they should take, but I will tell you that the cranberry seed does support Crohn's, diverticulitis, different things like that, because it helps the GI tract not be inflamed. Another thing it supports is the gallbladder, kidneys, prostate, and testicle detoxification. So it actually goes in and detoxifies those areas. One of the things that happens with people that have problems with their testicle health when they become older is it's because it's toxic. So this will actually, it's obviously not a Viagra, but it will go in and it will detoxify that system to make it healthier and to make it function correctly or function in a higher level. It's a natural source of vitamin E. So it's very, very important in that area. Vitamin E has very protective properties. It's a great antioxidant, and it's really needed and used in the eyes, throat, mouth, stomach, head, etc. Vitamin E is considered a catalyst, and what I mean by that is it can pass the brain barrier and go into the mitochondria of the cell. It can also be used to detox the cell, so it promotes brain health. Additionally, cranberry seeds are a healthy cholesterol level. It balances it. So with people, again, that have cholesterol problems, this will help balance that as far as support to the other products that you're on. It's a great source for this, and it's been used in numerous countries by numerous holistic doctors to support it. And then again, going back to this, the various articles that I read on the NIH government PubMed site showed that scientific studies show the consumption of these berries have potential of health benefits against cancer, aging, neurological diseases, inflammation, diabetes, and bacterial infections. It actually showed in some of the articles that it could regenerate the cells, which means definite plus for people that are looking at the anti-aging. This product would be extremely impactful in high doses in that area, and especially in the other areas that I've discussed as far as cancer and diseases and inflammation. So it's just another supportive product to the immune system that can help that system stay intact and not unlock an epigenetic